So good morning, good afternoon, everyone. I'm Dumebi Egbuna. I'm one of the co-founders of Chezi. If you're not familiar with Chezi, we are an ERG management software. So we help companies streamline and measure their ERG programming. But we're not here to talk about software today. We are here to talk about reproductive and maternal health in the workplace. So we are really lucky to be joined by Flory and Kevi from Reproductive and Maternal Health Compass. And they're going to talk to us a little bit more about looking at RMH in the workplace and then how we as ERGs and ERG leaders can advocate for those benefits in our workplace environment. So without further ado, I will pass it over to Flory and Kevi. I will also mention, that we will have a Q&A at the end of this session. So as we're going through this presentation, feel free to drop questions in the Q&A and we'll get to them at the end. But Flory and Kevi, feel free to take it away.
Hi, thank you so much, Numebi. We're really delighted to have this opportunity. And this is the first time that we've spoken to a group of ERG leaders. So we're very curious to share a bit of our kind of reflections in working with a range of employers in the US, but we want to make this super interactive. We want to hear your experiences, what pain points you've encountered or opportunities you see in engaging potentially inside of your own organization. So please be very active in the chat, ask questions, share your experiences if you're comfortable doing that. But again, happy to be here and thank you so much to the Chezi team for creating this opportunity. I'm Flory Wilson. I am the founder and CEO of Reproductive and Maternal Health Compass. We are a nonprofit. Our mission is to inspire and equip employers across the United States to provide quality and comprehensive reproductive and maternal health benefits, both through health insurance plans, but then also through the policies and kind of practices they have in physical office spaces. So what we're going to run through today, first, we're going to kind of talk about like, why does this matter in the workplace? We'll give you some context for why things are a little bit different in the United States compared to most other countries around the world. And then we'll talk about some of the specific issues, how reproductive and maternal health needs show up in the workplace, whether that's an office or a factory. And then we'll really dig into a couple of case studies highlighting how employers can show up for reproductive and maternal health and the needs of their workforce. And then lastly, we'll wrap with a discussion about how ERGs and how ERG leaders can be allies in this work. We will have an opportunity for a discussion. I know it'll be kind of a chat-based discussion, but just know that we'll be asking you to share, if you're comfortable, some of your experiences or some of your questions as we go. And the first thing we're going to do is a little bit of a poll to, again, think about kind of how the situation in the United States is unique. So thank you. Dumebi pulled up the quiz. You're going to see, I think, 4 or 5 questions. And so I'm going to give you a moment to kind of work through this full set of questions. Yeah, there are 4 questions. And maybe I'll define a couple terms while you're looking at these in case you're curious. If you're wondering what is an OECD country, OECD stands for the Organization of Economic Cooperation and Development. And the 38 countries that are OECD members are kind of considered like the most developed or the most industrialized countries around the globe. So imagine kind of the European countries, Japan and some of the other kind of Asian countries as well are all part of, as well as the United States are all part of that OECD list of countries. So the first question is, how many OECD countries have a health insurance scheme that relies primarily on employer-sponsored health plan rather than government-sponsored health? That's the first question. Again, you're picking a number of countries from that list. I should also say the OECD has 38 countries, so that's why the largest number is 38. The second question is focused on how many Americans actually get their health insurance through an employer-sponsored health plan. You can see the range of percentages there. Question number 3 is how many OECD, so again, we're back to that list of 38 countries. How many of those countries require paid sick leave for all workers? And then the fourth question is how many of those OECD countries require paid parental leave for all workers. So let's see, Dumebi, I think, can you let me know how many votes we have or kind of when we should go ahead and share out the results?
Yep. So about 12, 13 folks have participated.
So
14.
don't worry if you are guessing. That's actually kind of the point. But go ahead and kind of work through those questions. We'll give it another minute then. And then we can start talking through the answers and kind of what results we see, which is always super fun.
All right. I think we have about 15 participants. I'm going to go ahead and end it.
Okay, sounds good. So the answer to, okay, we'll close it and then can we see what the results are? I am not seeing the poll results on my screen.
It's shared with the attendees. So for number one, the
Okay.
answer is one. Do you want to just go? I think you have slides on it.
Yes, happy to just talk through. So what I love about asking these questions is we invariably find a huge range of responses. And that tells us like, oh yeah, people maybe don't necessarily think about how we get our care and how employers are caring for us in this kind of larger context. So the United States is the only OECD country that primarily provides health care via employer-sponsored health plans. The reason why I have these very quaint 1950s photos on the slide is the history of this is that in the post-World War II era, it was like 1947, 1948, as health insurance schemes were being stood up all around the globe, in the United States, businesses, large corporations went to Congress and lobbied. They said, look, we want to be the providers of health insurance. We see this as an opportunity to compete to get the best talent by offering really terrific comprehensive health care for our workforce. And Congress said, that sounds great. That makes a lot of sense. Let's do that. So that's when this decision was made, which has resulted in the US really being an outlier. I also do, though, think, when you read about or perhaps think about your own experiences with an employer-sponsored health plan or private health insurance, it really hasn't played out over the last 80 years in that way of, a race to the top where everyone has terrific benefits, right? I think most people's experiences are, wow, I had to fight to get, prior approval for this service, or gee, that doctor's visit wasn't actually covered and I didn't know until afterwards. Um, so again, the actual experience has been a little different. So again, do maybe if you're able to share the results from this survey question, that's terrific. Otherwise, I'll just kind of keep going. But question two is what percent of Americans get their healthcare through an employer-sponsored plan? And the answer to this one is 54%. So a majority of the American population is on an employer-sponsored health plan. The remaining population would be on Medicaid, Medicare, or might be purchasing their healthcare through one of the state exchanges. But today under the ACA, every American is required to have health care, although we also know that that's not necessarily the case. But the key takeaway here is the vast majority of Americans are getting their health care through an employer-sponsored plan. Okay, now let's kind of pivot over to a couple questions that are more around, the benefits and policies in the workplace. So we asked how many of those 38 OECD countries require paid sick leave for their whole workforce? The answer is 36 out of those 38. The United States and interestingly, South Korea are the only two countries in the OECD that don't have a mandated paid sick leave. I don't know why South Korea doesn't have it, but in the United States, this has been something that legislation has come up in front of Congress to cover all workers, and it hasn't passed. Now, the reality is the majority of workers do have access to paid sick leave, either because of state regulations or because their employer realizes it's actually a good investment in your workers to offer them sick leave, but it isn't required in many instances. And then the very last question is around paid parental leave and how many of those 38 countries require it. And the answer is all 37, 37 do, and the United States is again the only outlier in not having a mandated federal paid parental leave benefit. Um, why this matters is I think this really underscores when you take these kind of stats in sum, the fact that employers in the US are kind of left to their own devices to figure out what the right thing is to do on behalf of their workers. There may be some state laws. Now, in 13 states, paid parental leave is required. But, if you're not in one of those 13 states, you're kind of trying to figure out, what do my workers need? What can we afford? How might we structure this? So it puts employers in the U.S. in a tough situation, and we're really trying to help them figure out kind of how to do the right thing and why to do the right thing, because there's a really compelling business case to invest in these kinds of benefits and policies. So let's talk about the why. There are more women in the workplace today than ever before. Interestingly, a third of all women over the age of 55 are in the workforce today. That's a figure that's grown by about 7% in the last 2 decades. Why does this matter? Well, it's a reminder that women have different reproductive and maternal health needs over the course of their lifetime. And so when we think about this, we're really thinking about everything from menstrual needs through, fertility, childbirth needs, postpartum needs, as well as the needs of women who are in menopause, because we're all showing up at work, and we all may have, slightly different needs to be able to thrive and to be productive contributors to the workplace. Despite the fact that 47% of the workforce is women, there's still this kind of huge gap between the needs of workers, their preferences in the benefits that are offered, the fact that they really value these benefits. This is a very important part of the whole compensation package. And data that shows that especially younger workers, and what's cool about this data is when you disaggregate it based by gender, men and women alike in the millennial and Gen Z generations value having access to comprehensive reproductive and maternal health benefits. So what that tells us is there's a real opportunity for employers to support their workers. Let's talk for a moment about how reproductive and maternal health shows up in the workplace, because a lot of this, frankly, is not discussed. It happens in silence and can make a worker feel lonely or isolated. And despite that experience, there are some real opportunities for employers to step up and say, hey, we know this need exists and we're here to support you. So a couple of examples that I'll speak to. We've got kind of a set of images on the slide that depict various health issues that may show up at work. The first is menstrual needs. I don't know a woman who hasn't at some point in her career gone to a restroom during her workday or at a conference, realizes, oops, I need a sanitation product, and doesn't have one. And that just creates again, kind of a very avoidable, awkward situation. And there are clear solutions to that. But again, every woman I know has experienced that. But other things as well in the workplace are needs while you are pregnant. And so recently in the US, about 3 years ago, a piece of legislation was passed at the federal level called the Pregnant Worker Fairness Act. And this act requires companies that have more than 50 workers to provide reasonable accommodation. That can be anything from very simple things like allowing a worker to keep a water bottle next to her when she's working her shift or on a factory floor to ensure that she stays hydrated and healthy. This can also cover things like having a chair so that you can sit and rest during your shift work or during your work. Being flexible around modifying your uniform as needed, or being put on a different kind of job project during pregnancy. But a lot of workers don't know that that legislation even exists. So, to some degree, employers have this great opportunity to educate their workforce about the Pregnant Worker Fairness Act and then give examples of how they are willing and able to provide accommodation. Another example is after that pregnant worker has her baby and returns to work. We often are returning to work and still maybe lactating and wanting to express milk to feed our little ones. The data shows breast milk is terrific, provides great health benefits to the child and also to the mother. And so then the question is, how are workplaces providing accommodation? And the good news is also 3 years ago, legislation passed called the Pump Act that requires all employers, even small businesses, to provide a physical space that has a locked door, that is not a bathroom, where a woman can safely express milk. And then it also requires employers to allow workers to take as many reasonable breaks as they need over the course of the day to express milk. We asked questions about this in our survey, which Kevin will talk more about in a moment. But what we have found is more than 50% of the companies that we've engaged with are not currently compliant with the Pump Act. They don't have that dedicated space at their office, or they haven't identified what space they would use, and they don't have a written policy that gives guidance to workers about what the expectations are and what the supports are that exist to help those workers when they come back to work. Other examples of reproductive and maternal health in the workplace, fertility treatments. Often workers feel shame if they are needing to leave work to go to a fertility appointment. They don't know if it's covered. They don't want to talk to their manager about it. And by the way, this is something that is true for women and men. So having a policy that says if you need to take some of that paid sick time to go to those fertility appointments, you are welcome to. We support it. As well as being able to take paid leave when you do have a newborn. Again, paid parental leave is gender agnostic. More and more companies are offering this benefit to both men and women. Anyone who has become a parent, whether it's through childbirth, adoption, and surrogacy. And so this is really kind of a whole workforce issue. But that's just kind of a set of examples. Actually, one more example, hot flashes. If women are in perimenopause and menopause, and this is a phase of life that on average is more than 10 years of a working professional's lifetime, um, how can she be supported? If she's having, sleep issues or, mental fog issues, how is a workplace supporting her through what's available through a health plan, what's covered through a pharmaceutical benefits plan to ensure that she's getting the care that she needs? I'll go on to the next slide. I already kind of spoke to this, so I'll move through this one quickly. But again, this shows what workers want and what is actually available to them. And again, you disaggregate this data by gender. The figures don't change. Men want these benefits as well. And I emphasize that because in many cases, a family might be on, one adult's health plan. It could be the man, the husband, the partner's health plan, or a woman's health plan. So these issues really do transcend gender, because it's about getting the care, that the whole family needs. Um, so one thing I want to note, as Dimebi and I were talking about this, as we were talking about, the session, um, you might notice that we've been talking about reproductive and maternal health very much through the lens of the business case, right? If your workers are healthy, if they feel cared for, they are loyal, they are productive, they show up, they don't leave, right? If you've got a great benefits plan, you're more likely than not to stay in your current role. And so offering these benefits boosts productivity, boosts employee retention, and allows companies to recruit top talent. So we see these issues as a core business imperative and a business opportunity. But we also, of course, recognize this really matters for creating an inclusive, equitable workplace to ensure your whole workforce can show up and participate actively. We're going to talk a bit more about some of these specific topics and case studies. But the way we are working with employers is by providing them with tools and a framework to understand where there might be gaps in the benefits that they offer and how they can strengthen their health plan offerings. And so I'm going to turn it now to my colleague Kevi, who can talk a little bit more about the way we work and the data that we have. So I'll turn it to you, Kevi.
Thanks, Lori. It's great to be here with everyone today. My name's Kevi Keaton, and I'm the head of client success here at Reproductive and Maternal Health Compass. And as Lori mentioned, the bread and butter of what we do to support companies as they think about the way that they support their workers around reproductive and maternal health is through our survey framework. And we use this to help them evaluate how they are or how their benefits and policies are supporting reproductive and maternal health for their workers. As you can see here, our survey is designed to be confidential, informative, and aspirational. So when companies come to us and take this assessment, we're just sharing these results with the company. Nobody else. The data stays with you. They are really meant to be informative. Each company that partners with us through our survey is given really informative, clear, data-driven insights and recommendations around, how they can make improvements, whether that's through their benefits or through their workplace policies. And we support them through the next steps as well. And it's supposed to be aspirational. We are here to inspire companies to do better for their workforce. And so by giving them these recommendations and the support to put these into place, we're hoping that that we can, help them improve the lives of their workers and their families. And in doing this work, we've been able to support employers in a number of ways. So first and foremost, we're helping benefits teams do more with less. So as everyone on this call probably knows, health benefits documents are not easy to read. They're not easy to read for employees, and they're also not easy to understand for HR folks. And in the vast majority of companies that we've worked with, we have helped identify benefits that are within the reproductive and maternal health realm that the HR teams were not even aware of. And so by identifying these, we can, help these teams amplify those benefits and ensure that their workers know about them. Second of all, we can provide low cost and actionable recommendations. Many of the recommendations that we are providing to companies are no cost or low cost and can make a really big impact. And we'll talk about a little bit of those in a moment. But in addition to being low cost and actionable, they are, we're helping to provide the tools to make them easy and quick to implement. And then lastly, we want to inspire your workforce and others. So we are really excited about our RMH at Work Leader accreditation that allows companies that are setting a really high standard for reproductive and maternal health care of their workers to be recognized and to, both inspire other companies as well as the folks that they, using their accreditation to attract top talent and to ensure that their employees feel proud to work at their organization. So, of course, we'll talk a little bit more about some of those examples for how companies can really make those policy and benefits changes. And so, once you take a look at those, if you want to bring this to your HR teams, we really try to make it as easy as possible for folks to get this assessment done and get insights and recommendations in their hands quickly. Companies can take our online assessment, or our newest and hopefully most streamlined way is for us to essentially take that off your HR team's hands and do the assessment for them. So just by providing us with a couple of key documents around the health benefits plans, pharmacy benefits plans, and all of your workplace policies, we can do that assessment really quickly and get some recommendations in their hands. You want to, there we go. And so this is just a sample of the different employers across the country that we've supported over the past few months. And as you can see, there's a really diverse range of companies here, both in terms of the range of industries that you'll see and the sizes. And really, all of these organizations have taken similar actions to make improvements for their workforce. Um, I'm sure that you can recognize some of these names, and we're actually really excited. Levi's is on here. I mentioned our RMH at Work Leader accreditation. They were actually our very first RMH at Work Leader. And so thinking about, an organization that has different types of workplace settings, a huge variance in their workforce. So between corporate, factory, and retail workers, making sure that they have equitable policies in all of those places to ensure every worker gets the same level of reproductive and maternal health support. We've been really excited to support them and all these others on here. So hopefully that helps you get a sense for, gosh, if Levi's and all these other companies can make these changes, mine can as well. And just to give you a few examples about, how workplace policies can impact reproductive and maternal health care for workers. You'll see here, this list actually goes on and on. But some of the ones that we've been talking about with employers recently, what I mentioned, no cost and low cost recommendations. Many companies that we work with do not have a bereavement leave policy that specifically outlines that workers can take paid leave for pregnancy loss. And so that is a no cost change that we are recommending to all companies. Just, explicitly say that can be a reason to take paid PTO and paid bereavement leave, so that there's no confusion when workers are in a really hard and uncomfortable time. The other piece is around lactation accommodation. So Flory mentioned the Pump Act earlier. We are, supporting companies in making sure that lactation accommodations don't just, meet the requirements of the Pump Act, but are actually convenient and comfortable for your workers. Have a separate refrigerator so that mothers who are expressing breast milk do not have to put it in the same refrigerator as everybody else uses. So some really simple and, again, low cost changes there. And then when it comes to your health benefits, again, these are just some of the many examples of how benefits can make a difference and an impact in your reproductive and maternal health support for workers. We have been speaking a lot with companies around ensuring that fertility and family formation benefits eligibility is inclusive. So, ensuring that families who have same-sex parents, or people who are single by choice, or folks who may have a medical condition that shows that they immediately need fertility support, can access those equitably. And we also have been talking with a lot of organizations around providing a medical travel reimbursement, either through your health plan or another third party, to ensure that folks that live in restricted states can get equitable access to reproductive care. That's that. You can go ahead, Lori.
Did I skip one of these, Kevi? Or
That's okay. Yep. And we were on that side for a moment, and I was able to kind of talk through some of those policies, some of the main ones that we've been talking with companies about.
Okay, perfect. Then I will go on to these discussion questions. We would love to kind of hear from you all. I just dropped these questions into the chat as well. But we're kind of curious, have you had Do you feel first, do you feel informed about kind of the care and coverage that is available to you through your current employer? If you don't, do you have ideas for kind of how or where you might find that information? Um, I don't have it as a question here, but we are always so interested to hear stories from folks if they're comfortable sharing on, yeah, gosh, I didn't have this benefit and didn't know until I needed it, or gosh, I did have this benefit and it was transformational. I mean, one of the things that's really, powerful about doing this work is hearing these stories of how really transformational it can be for employees to have these benefits. Um, I will keep these questions in the chat. Um, I'm not seeing any comments right now, but folks are probably kind of thinking on these questions. And so as you're giving thought to the prompts and hopefully typing in your own experiences, I'll go ahead and I'll talk us through kind of the next couple of slides, and then we'll open up for Q&A and more discussion as well. So, we know that this is a group of people who are really committed and motivated to their ERGs inside of their own workplaces, and, might be thinking about how can I harness the power of my group to be an ally or an advocate on these issues. And so we have a couple of kind of specific actions that we have seen other ERGs take and have been, fruitful. So of course, the first is doing your research. We know this is not easy, so we by no means want this to, sound like some kind of minor ask, but if there's a team or a small group in the ERG who, has kind of a list or a set of ideas around benefits that they know would be important, taking that and then cross-referencing it with the benefits that are currently offered. And, those kinds of documentation where you find that data includes like summary plan descriptions for your employer-sponsored health plan. Other places where a lot of this data exists would be like a pharmaceutical benefits plan, understanding which medications are covered, are fertility meds covered, is there a cap? Understanding those kinds of, or looking in those places rather, is a great way to understand what's on offer through a health benefits plan. And then, of course, an employee handbook, where a lot of those kind of workplace policies, that's where your paid sick leave, your parental leave benefits, that lactation accommodation benefit as well. All of that information should live in an employee handbook or on an employee portal, where a lot of that data is. And I would also just say all of those kinds of documents and places that I just noted are the exact resources that we use to extract information on benefits plans. And those are often the places where we will find, as Kevi noted, benefits that the HR team weren't even aware that are covered. We find that information, on page 347 of a summary plan description. So they are really helpful resources, even though they're super dense. But that's a great starting point. The next approach or path is, of course, asking questions and really engaging with HR teams. And I'll say, as we've been doing this work, I have been consistently inspired by the hunger that HR and benefits professionals have to get this data, to understand what are the, health needs of our workforce, where are there opportunities for us to strengthen and take action, again, especially in this environment, what are those low cost or no cost actions that we can take? But when we present those options, HR professionals are like, yes, we want to do this. We care about our workforce. It's their core mission. And so they are terrific allies in and of themselves. And so they can be great collaborators and thought partners. And then of course, advocacy is always easier when you've got, a group of collective and diverse voices. So engage in groups like women's ERGs, parent ERGs, LGBTQ ERGs are great. These issues transcend all of those groups. They transcend the whole workforce, actually. And so, one thing that's not included here, but that I would just call out is engagement. These issues are relevant to them, and even if they're not necessarily active and involved in those ERGs, when you engage one-on-one in a conversation, you will find, oh, yes, this is an issue that is important in my own household, and they can be terrific allies. I think this is my second to last slide. But we also wanted to note, how can ERG leaders be allies and advocates? And beyond engaging through an ERG, there are these other really kind of powerful ways to lead by example. So what we often hear is, gosh, yeah, I have really great benefits, but I'm really uncomfortable talking to my direct manager or supervisor about some of these issues. So if you're a people manager, you can show up differently. You can show up as a compassionate, informed leader who respects the privacy of their workforce, and discusses these benefits in both an appropriate way, but also in a compassionate way. And people managers who show up that way consistently have the happiest teams, have kind of top reviews. And so it's a way both to support your workforce, but also to help promote yourself as a terrific people manager. The second example is, again, if you're more of a business manager, maybe you're, managing, a balance sheet. But again, showing up as a thoughtful and aware manager, who supports people, recognizes we need time away from work to care for ourselves and our families, then being able to demonstrate through that financial performance that, hey, these teams are more productive. These teams are having lower turnover. These teams are getting the top talent because these teams are caring for their workers. That's another way to be an ally or an advocate. And just the last point, I already kind of noticed this, but just being a voice, using your power, it can be, hugely impactful. I'll maybe give one anecdote on this. After the Dobbs ruling overturned Roe v. Wade in 2022, I had a lot of conversations with my partner, about how, excuse me, how his workplace, which has workers in all 50 states across the country, how they were responding, and whether they were kind of providing guidance to workers on what benefits were available to them. And he said, yeah, I know there's been some conversation. I know they're working on it. And a couple weeks went by, and I said, hey, did anything ever get communicated? He said, oh no, I can't, I don't think it did. I haven't seen anything. And I said, go talk to your HR manager, go talk to the president. And I said, look, you are a safe ally. This is not something that you yourself need, but you can show up as someone who knows that other folks in your workforce may need it. And so he did. And 48 hours later, an email did go out to the whole company that just said, here are the benefits that are available to you. We want to make sure everyone knows you have options. So I'm very proud of that little anecdote. I always like to share it. So that's kind of the end of our set of slides and what we wanted to share. But again, we're really eager to hear from you. I'll pull up the chat in a moment, but also just want to note that if you want the set of slides that we reviewed today, if you scan the QR code that's on the screen, it'll take you to a page on our website where we can grab your info, and we will share with you both the slide deck today, as well as a set of resources that we have on the RMH Compass website that actually provide kind of templates, sets of questions to have conversations around a range of different health topics with your HR teams. So there's more on our website around how to be an ally, and we will happily send that to you if you scan that code. And so let's see, I'm going to pull up the chat, and thank you, Melissa, for commenting on your own experience. Okay, you have your babies are 16 and 13. They'll always be babies though. And I'm so glad to hear that you had an employer who um, had that lactation space and provided that accommodation. But oh wow, but you didn't have paid leave. Wow. So I imagine you had to probably go back pretty soon after having your kids, which is, very kind of physically challenging as well as mentally challenging. Um, I would say that's something that I think really we collectively have made a lot of progress in the last decade. I will just my babies are 13 and 11, and when we had them, I had maternity leave, which was terrific. My husband had no paid paternity leave. And today, in both my former workplace and his workplace, they have gender neutral parental leave policies. And, many of them now are 8 weeks, 12 weeks, some are even 16 weeks. So there has been progress there. Uh, any other kind of questions for Kevy and I? Um,
I'd encourage folks to put questions in the Q&A chat. We have Flori and Kevy here who are subject matter experts. If you have any questions on how you can advance RMH in the workplace, would definitely use this opportunity to ask them. And then as a reminder, this has been recorded, and I will also send over the slides next week. I'll have like a Google Drive with all Connection Week presentations in there.
Terrific. Well, and if anyone has questions that they want to kind of take offline, my email address, Kevy's email address, is at the bottom of the slide. So we're always open to having conversations. And I should also say we are also really open to coming and kind of presenting more on these issues and this work to ERGs as well. So if that's of interest, please reach out.
All right, a couple questions in the Q&A. First one, what are your thoughts in stipends to cover things like IVF, egg freezing, etc.? How would you suggest ERGs advocate for this as women?
Yeah, that's a great question. So it sounds like the question is specifically around a stipend. I'll tell you what we are typically seeing in health plans. I mean, very often I would say a base, your Cigna or your Aetna health plan may not cover any family formation benefits. It might, but it might not. If it doesn't, many employers are now going to these kind of third-party platforms such as Progeny, Maven, Carrot. I think those are the three largest, but it is a crowded space. There are a lot of providers that are providing really comprehensive family formation benefits. And so, there may be, in addition to, IVF and other kind of fertility benefits, there may be funds available or, services that help cover components of surrogacy and adoption that are covered through those third-party platforms. So that's always an important place to look to see if there are benefits that are covered. In addition to kind of some of those services, we also have seen instances where an employer just offers a stipend, and it's kind of a direct payment to an employee as requested by HR. Those always have a lifetime reimbursement cap, so there's a maximum cap, or they may be priced for as per child. What we're seeing, a couple things. I'd say I'd say a good benefit, but one that we see commonly, but certainly not universally, might be a lifetime max reimbursement from the employer of $40,000. And the $40,000 could be used again for IVF, for surrogacy expenses, for adoption expenses. We've seen as high as 75,000 lifetime expense. We've seen as low as zero. So there is a full range, but that's what we're seeing. And then the last example I would give is we've also seen where the cost is maybe segmented out. So something like $10,000 in adoption or surrogacy per child, or $10,000 for fertility, pharmaceutical costs, because there's a lot of medication often related to that IVF cycle or egg freezing and surrogacy. So we see a range both in the dollar amount and then also the approach and strategies used. I think a stipend is good. We also think that, many of those third-party platforms are really good, but if we're talking specifically about adoption and surrogacy, that's where reading the fine print and seeing are those services covered or how are they reimbursed is really important. So that's a great question. Thanks.
Awesome. Next question. Once you identify opportunities for improvement, do you have recommendations for next steps, i.e., vendors, ideas, etc.? Obviously, you all would be a resource, but any ideas there?
Yeah, Kevin, you want to take this one?
Yeah, the short answer is yes. So as we identify recommendations based on where a company performs against their peers, against similar organizations and organizations of similar sizes, we have a number of different resources to help put those into place. We have sample policy language. If it's a policy that a company may want to consider changing, we have a lot of templates and essentially things that they can copy and paste. Again, really with the goal of making it really easy to make those changes. And then when it comes to, changing benefits, there's a number of different ways that we can provide support there. Sometimes it's, creating emails with compelling language and compelling evidence to have the HR and benefits teams send off to their benefits brokers to help advocate for those changes. Sometimes it's providing, our own research to help the HR teams kind of advocate internally for increased spend on a certain benefit, to their CFO or to whoever it might be. And then when it comes to kind of vendors, things like that, we are certainly well versed in a lot of the vendors out there. So the ones as Flory mentioned, those third-party benefits providers who support fertility, family formation, and there's many out there now that are looking into kind of menopause support for women who are going through that phase of life. And so between a lot of the retail companies turn to us to say, gosh, we want to provide lactation spaces for all of our employees when they need them at all of the various locations that we have across the country. And we can provide them some vendor ideas for those kind of mobile spaces as well. So yes, we have a lot of recommendations. Our team is well equipped to support HR teams and benefits leaders through all of those.
I would just add two things, actually. I'm realizing I don't think we have mentioned RMH Compass is a nonprofit. So right now we're working with companies. There's no cost to the company. And so all of those resources that Kevi just mentioned, those are like free. They're public good. They're accessible. But our theory of change is that equipped with information, companies can do better and care for their workforces. And so in the last 6 months, every single company that we have worked with has implemented at least one or more of those improvements that we've put in front of them within a month. So, these are really actionable improvements that companies or that we are highlighting for companies.
Awesome. Last question. I understand that a lot of space support is critical to in-person spaces. Are there any considerations for supporting a remote workforce around lactation support, etc.?
I can take that one, Flory. Yes, I think when it comes to lactation support specifically, I think, many companies have written policies in place that say workers, regardless of their location, so including remote workers, can take as many paid breaks as needed to express breast milk. And so that is one of the recommendations. So whenever a company comes to us to take our assessment, we do have them fill out a couple of, intake questions that outline the different locations of their workforce, including whether they have folks that are fully remote. And so we do look for that. We look to see if they have those policies in place to support their remote workforce. So with that example in particular, it is something that we often recommend to companies.
And I would just add, it's super helpful when a company says, and this is how you should implement it, work with your manager or work with HR, block out the times on your calendar, like whatever those expectations and norms are, but the more clear and transparent the company policy can be, then the smoother it is for the worker and their whole team to take advantage of the benefits.
Awesome. That was our last question in the Q&A. Anyone have any other questions that you want to drop in the chat? All right. Well, Flory and Kevi, thank you so much for joining Chesy Connection Week. I think this was a great session, especially for those who are leading women ERGs or want to be allied to women ERGs. To our audience, thank you for joining on a Tuesday. We will be sending over these slides as well as the presentation in a follow-up next week. And then I would encourage you to reach out to RMH Compass if you want to bring them in to talk to your some folks in your workplace to see how you could advance RMH benefits. Flory and Kevi, I'll give you kind of last word.
Yeah,
Thank you.
I
Go
was
ahead.
going to one say thank you so much to Chesy and to everybody who joined, and just to reemphasize, we're always happy to join one of your ERG meetings and talk a little bit more about what we do. And we also have some resources for folks like you who are champions and want to take this, to your HR team. So please, scan the QR code, get in touch with us. We're really happy to support.
Yeah, Kevi said it all, and so I'll just say thank you for your time and your interest, and we really are grateful, Dumebi, to you and the Chesy team for this opportunity. So thank you so much. Have a great day, everyone.
Bye.